Welcome everyone. You'll see from what just popped up on your screen that we are recording this. We expect a number of people to want to view this conversation, but just couldn't be on today for whatever reason. I am clicking mute all right now, just so we don't hear any background noise. My name is Evan Rudder. I'm the Assistant Vice President for Alumni and Parent Engagement and alumnus of the college. And it is a pleasure to have all of you here. And I'm very excited for our panel and for our discussion today. The college is nearing the end of its fiscal year, June 30. We, of course, sent our students home in mid-March, and we are working extremely hard right now to reopen and welcome everyone back in August. So thank you all for your thoughts and wishes and your support. Happy Father's Day to everyone on Sunday. And if you haven't yet made your fiscal year-end contribution to the college, please go to cmc.edu/giving and make whatever you can in these difficult times. The college would certainly appreciate it, and it would certainly be helpful as we weather COVID-19 and work to bring students back. So your continued support with both time, talent, and treasure is always appreciated. It's my pleasure to hand the reins of this talk over to Ryder Todd Smith, alumnus, class of '96, founder and CEO of Ryder Smith, and a past president of the Alumni Association. Ryder, the floor and the show is yours. Everyone feel free to submit questions via the chat or virtually raise your hand when we get to the chat, the Q&A portion. Thanks, everyone.
Awesome. Well, thank you, Evan, very much for this opportunity, and to Claremont McKenna College for providing these virtual environments for alumni to get together. I feel a little bit like I should have some sort of beverage in my hand over here whenever I get with this many CMCers around me. So I'm missing it right now, but it is before, well, it's 5 o'clock. Technically, this could happen. As Evan mentioned, my name is Ryder Smith. I am a co-founder with another CMC alum, Nicole Danielle Trepepi, now Danielle Smith. We founded a firm called Trepepi Smith. We do marketing, communications, public affairs, and local government. We work with over 60 cities in California. And so we live and breathe local government. And we're going to hear today about the local government world, which for some folks isn't always the most sexy, but the reality is it is on the front lines of all the major issues we're facing today. Indeed, if you look at policing issues, which are a very hot topic right now, that is almost entirely done by cities or by county governments throughout America. So we have two awesome guests that are going to join us today, people who I got to know as friends of mine in college. And I'm going to ask them to introduce themselves first. So I'm going to start with youth first and go with Jessica O'Hare, Jessica Witt, but Jessica O'Hare to many of you who know her from CMC. Jessica, you want to introduce yourself?
Sure. Jessica Witt, class of 2000. I was a government Spanish major at CMC and had the honor of working at the Rose Institute and was student manager at that time. Sean actually hired me, which is a fun fact. And since graduation, I have been working primarily in local government, both on the elected side for a member of our Orange County Board of Supervisors, and then did some lobbying, actually working for CMCer Chris Townsend for a couple years at the state and federal level, and then have been back at the County of Orange for about 10 years now in a variety of roles. Most currently, I serve as the Director of Government Community Relations, reporting directly to our County Executive Officer. And in that role, oversee media, legislation, administration for the CEO's office, and also have the delegated role from the CEO to serve in the Director of Emergency Services role in certain situations. And so that's one of the roles I played most recently during the response to the COVID-19 pandemic.
Awesome. All right, and Sean, why don't you a little bit of background on you too, please?
Good evening, everyone. It's nice to be with all of you. My name is Sean Elsbernd. I graduated from Claremont in 1997. Went straight to law school, graduated from the University of California, Hastings, College of the Law, 2 blocks from me here in downtown San Francisco in 2000. After graduating from law school, I came and worked here at City Hall for a member of the Board of Supervisors for a few years. Long story short, he left office. Then Mayor Gavin Newsom appointed me to his seat on the Board of Supervisors. 3 months later, I had to stand for election and ran against 14 people and won. Ran again 4 years later for re-election and won. So I served 8 years on the San Francisco Board of Supervisors. And when I turned out of office, Senator Dianne Feinstein reached out, asked me to join her team as her state director. Worked for her for 6 years. And then Mayor London Breed, the new mayor of San Francisco, who was elected in 2018, asked me to come back to City Hall and join her team as chief of staff. So I have been in that role now for almost 2 years. And in this role, a lot of responsibility, 60 city departments, 30 to 33,000 city and county employees, $12.5 billion budget, play a leading role in managing all of that.
All right, thank you both. So two very successful professionals working in the local government sector. Admittedly, this is a California biased panel and that they're both in California, but I think a lot of our alumni are, and there are certain realities here in California, complexities that'll be universal to the nation. So this should be relevant to everyone. Jessica, I was wondering if you could just take a couple moments to talk about the relative roles of city, county, state, Fed government, what those generally are, just to make sure people are properly oriented to what the county is ultimately responsible for typically, to help frame up people as we go into our discussion about COVID-19.
Well, I always kind of talk about county government as the lost level of government in a lot of ways, right? People I think have a decent understanding as to what their members of Congress do, what their state legislators do, and what their cities do. And the county level, it has a very important role, but I think a lot of folks usually don't come in contact with it, right? So you hope to never run into the sheriff or district attorney or need a public defender, right? You hope you don't need those services. And we provide a lot of we are a subdivision of the state, and we provide a lot of the social safety net services. So also you hope that you and those you love never have to make use of those services. We're all glad that they're there, but we hope that we never have to use them. And then it does provide a very, a strong regional coordination role within the county geographic boundaries. So whether those are regional public works projects, or for the county, we do landfills. And a big piece of that, which has become, I think more people have become more aware of, is our public health efforts that we take on. In terms of having a public health officer, which has, I think we've all learned, has a lot of really immense powers that, I think have dated back long ago, and have that response effort. And that's become really critical as of late, and I think has probably opened up people's eyes as to what that role of county government is, that they may not have been familiar with prior to the pandemic, and has a coordination role, especially in terms of emergencies. We're responsible for leading we have an operational area which involves all of the cities and special districts, and help coordinate those emergency response efforts on a county level.
And then something unique too that I just want to point out for Sean's benefit, or have Sean comment on, but in Orange County, Jessica, we have 32 cities, 28 cities?
34.
34, sorry.
Come on, Ryder.
I know, I should do better. 34 cities in Orange County, but Sean, San Francisco is particularly unique. Could you talk a little bit about what makes them unique as a county?
There are many things, Ryder.
That's fair.
I think what you're getting at, Ryder, is that San Francisco in the state of California is the lone city and county. So, every now and then people will do the comparisons. San Francisco's got a $12 billion budget, Los Angeles, city of LA, or some other city. But we have all of the city functions and all of the county functions under the mayor's office. We have no city council. We just have a board of supervisors. They are our legislative branch. So in addition to the public health responsibilities, in addition to the sheriff responsibilities, we also have a police department, a fire department, a rec and park department. All of those city agencies and county agencies fall under our responsibility.
All right, so it's a big role, big function to play there. San Francisco is unique in that respect, and just keep that in mind as we hear today from our experts on the panel.
Just press pound to continue.
Uh-oh.
You are.
Thank you, Evan. All right, so when did COVID-19 get serious for your agency? Jessica, why don't you go first?
So I actually had to look back. Ryder and I were kind of joking about like COVID-19 time is a bit of a time warp for us all, right? And I actually had to look back that we declared our local public health as well as local emergency back on February 26th. So we've been at this a long time. And we had reported 2 positive cases in early March. And so we were, I think along with San Francisco as well, probably some of the first counties that had declared that local public health emergency, which one of the key functions of that role is that when you're in emergency situations, there are certain powers that come along with that. And also it opens up the possibility for funding, which I think at the time we probably didn't have a good concept as to what exactly would be needed. Now we have a much greater appreciation for, you know, the resources that have been needed to both respond to the pandemic, but also to work through the recovery. And that's been one of the things that I think has been, you know, unique in this situation, is that it's transcended so much time. Because typically, you know, in counties, we're used to fires, we're used to floods. Those are kind of our primary, knock on wood, usually the emergencies we deal with. And those have usually a pretty clear start and end. You know, we're tracking the weather, we know when the storm's coming, we know where all the barricades have to be placed and all of that, and then it's done. And then we clean up and we move on to the next thing. Same with fires, although they're unpredictable. There's a greater rhythm to those types of emergencies. And with the pandemic, that's what's been, I think, especially challenging, is that there is no rhythm. You know, we've never seen, thankfully, anything like this in any of our lifetimes. And just that duration of that response, and it's still going on, has been really challenging at a lot of levels.
Yeah, I just second that, especially the end game. We have no idea when this will end. For us, we did start a little bit earlier. We declared our first state of emergency last week of January, well in advance of any positive test in San Francisco. We largely did it, per Jessica's point, on the financing. We wanted to make ourselves available, or eligible, excuse me, for additional funding. It also, by declaring an emergency within our city charter, it allowed us to shift some financial resources from one agency to another without having to go through our legislative process. We really stepped up our effort by the late part of February. One little example for those of you who know San Francisco, we have our emergency command center a few blocks west of City Hall, but by the end of February, we had moved into Moscone Convention Center. Our regular emergency command center just not big enough for the number of people. We have over 500 people down at our convention center doing various elements of the response, and have been at it since then. And again, no end in sight.
So, and could you both just talk about that real quick? Because I think, Jessica, you also had the role of Director of the Emergency Services for OC for a while too, as part of your responsibilities, or of the EOC, is that correct?
I did. For the first couple weeks of for the first week of the response, probably give or take a little bit, the CEO's office was serving in the Director of Emergency Services role. And I was the person up there in that delegated authority role, you know, in constant contact with our CEO and our board with regards to that situation. And we eventually kind of made a shift to the Sheriff's Department to lead that role. And then we've actually, by this point, we have kind of wound down although the response is still in full effect, we're able to handle that more at the agency level between our healthcare agency and coordinating through the CEO's office. And then that was just within the last week or so that we went back to duty officer status, so not a full activation of our emergency operation center, because it's really that coordinating role. And so we were able to scale back a little bit, because also while we've been in this pandemic, we've also had other emergencies occur. So that's been also very challenging. I think not all of them required a full open, having the EOC operational for those events, but we had a cold weather event, we had a heat event, we had an earthquake, we lost power to our emergency operations center. And then in the last few weeks, we've been responding to the demonstrations as a result of the death of George Floyd. So because of the duration, all of these other things have happened along the way, which again, you have a lot of the same people who respond to those various emergencies, and at some point you just start running out of people.
Right. And Sean, just to paint the picture for me, when you talk about 500 people at Moscone Center, is it literally you have this hive of activity, everybody sitting around tables, big charts on the walls and display boards, and the whole idea is to create a nerve brain center where there's immediate communication across the organization?
Simplistically, yes. And of course, sitting around tables socially distant with their masks on. But yes, we've taken over the entire convention center. We've got the Human Service Agency Operations Center, the Department of Public Health Operations Center, the Joint Information Center, perhaps the most key central piece of the whole thing, being as transparent, getting as much information out to the public. The public safety, the transportation, they are all in that one place to, yes, facilitate the communication, make it much easier, smoother, more efficient.
Okay. So where are we today in your respective counties and what comes next? And Jessica, why don't you start us off with that?
If only I had a crystal ball, Ryder, if only. Well, we're still in response, and we're in response and recovery, right? So that's what's also challenging as well, because we, are still responding to the emergency. We're, have rolled out robust testing and are trying to, launched a outreach campaign to encourage more people to take, advantage of those resources that are out there. And we continue to work to reopen the county. So also all that messaging, because the way it works is that in most situations is, the governor has allowed for and provided guidance on reopening of certain industries. And then the public health officer has to kind of allow for those, and looks at that on a county by county basis and working closely with the state on that. So we're starting to reopen, businesses in different sectors. And then also it's the recovery piece. Our board allocated about $75 million, $15 million to each district roughly of the money we received from the CARES Act, which was the federal funding to support the response efforts. And those are going out to local businesses. So that's in process as well, because we know that in addition to, the impacts of the response have been very severe on the economy, and trying to find ways to provide kind of that much needed support to those local businesses and other industries to help them get everyone back to work as best we can. And it's been interesting too, because the county not only is, and I'm sure Sean's kind of experienced this too, we're not only working on the response, but we're also a big employer, right? We have 18,000 employees. So we're struggling with a lot of those same issues that businesses are struggling with, how to get people back into the workplace and making sure that it's a safe environment for them, working on the social distancing, making sure that we have things in place for our public counters. So we're experiencing those same challenges that a lot of businesses are facing as well.
Yeah. And Sean, how about what do you kind of see? And we have this concept here in California, like most places, of stages, and we move in between stages. And I'll say this, it seems like the governor moved very slowly on a lot of fronts, and then all of a sudden got into a mad rush and moving through stages. And then today, just here in California, the governor announced a mandatory mask in public, which for Jessica's sake, this kind of contravenes recent orders that have come down in the county in terms of requiring masks. If I recall correctly, Jessica, if I'm misstating that, so be it. So it's kind of been a lot of moving parts, Sean. Where are we at from a stage perspective in San Francisco, and how else would you comment further on what Jessica had to say?
From a San Francisco perspective, what the governor has done has been, I guess I'd characterize it nicely as informative, but it has certainly not been in any way anything that has been critical to our decision making. We really have done our own process because as much as the governor, you may have said, has been moving slow, our pace has been rather methodical from the beginning. And we do have our critics who are saying we are moving too slow. But just let me just brag a tiny bit. Since this started, San Francisco, we've only had 44 people die. We have the lowest death rate per 100,000 in the state. We have, right now, there are only 8 people in all of San Francisco, not just public hospital, public and private, in the ICU. We have a number of patients that have been transferred from Imperial County because we have the capacity. And on the health side, we really have, I wouldn't have said this a month ago, but I can say it today. We haven't just flattened the curve, we've crushed the curve. We have done very, very well there. That said, to maintain that momentum, again, we've been very methodical in how we've opened. We have done really significant analysis on what we refer to as movement, analyzing how many people would be moving to get to, as we open elements of industry. And we are gating is the new verb that we use as how we open up these businesses. We just started, today's Thursday, on Monday, or excuse me, last Friday. It was a special treat to start it on Friday, outdoor dining. We are, if we stay on track, indoor dining with significant restrictions may come in after the 4th of July. We just started on Monday indoor retail with very specific restrictions. We have been very slow, however, with our downtown core in opening up office buildings because as everything is connected, especially with San Francisco, you open up downtown office buildings, that means more people are getting on BART, more people are getting on Caltrain, more people are getting on Muni. Very difficult to socially distant on there. What is that going to do to the reproductive rate of the virus? And what does that mean for the entire region? And we're also mindful, the epidemiological phrase I've come to learn, the reproductive rate of the virus. Our reproductive rate is low. Alameda County, San Mateo County, our neighbors, not so low. If all of a sudden we start bringing folks in, what is that going to do to San Francisco? So balancing all of that, absolutely the most fascinating and challenging thing I've ever experienced in my career.
Wow. Well, big, I mean, the challenges are balancing the huge economic impacts to your city, and the counterintuitive point there, the challenge you face is, like, I think you said you have 8 people in hospital beds right now for this?
8 people in the ICU. We have 36 people overall in the hospital. And just on the economic numbers, here's the horrible number. Since this all started, San Francisco has had 120,000 people file for unemployment. Our working age population in San Francisco is approximately 700,000. In the Great Recession 10 years ago, that entire year, only 40,000 people filed for unemployment. So to put it in perspective, I mean, our service industries have just been decimated. And San Francisco's golden goose, what makes our engine hum, is tourism. Our hotels aren't operating. Pier 39 is on the border of whether or not they're going to be able to survive much longer. I mean, some of it, it's very daunting what we're facing right now.
Yeah. Jessica, any comments along Sean's lines too in terms of economic impact in Orange County to note?
Well, we're very dependent on tourism as well. And especially, I think the timing of everything coming into the summer, there, continues to be huge impacts on, the hospitality industry and the tourism industry and things like that. So, been trying to give that guidance to those entities to be able to, reopen as safely as possible. And, for us to, we know that Disneyland has announced that they'll be reopening in July. That's the plan. If the governor kind of comes, we get that additional guidance coming down from the state level on that. And, that's a big economic engine for the county and especially for Anaheim.
Yeah. I'm curious. So we talked a little bit about data. I would just be interested to know, where do you guys get your data? What are your sources of data? What data do you rely upon? Is it the state of California, CDC, the WHO, university studies? Like, there's a lot of concern about valid sources of information, data direction, media interpretation on data. Where do your agencies rely on that? Sean, why don't you go first?
We largely do our own, Ryder. I mean, certainly there is no, at least the way it has been explained to me, there is no more important data set than hospitalization rates. That's really the key driver of our opening. That said, we are great beneficiaries of having the University of California, San Francisco in our backyard. And we are using a lot of their great team. They have been modeling our curve. We get our weekly updates on our reproductive rate through a team of folks at both UCSF and UC Berkeley. But we're largely doing our own data sets.
Okay. Jessica, how about for the County of Orange?
And we're doing our, compiling our own data and then working very closely with kind of the state. A lot of that information is funneled up through the state as well. And, I think that's one of the things is that we're all in new territory on all of this. So I think it's also just looking at all the data and information that's out there in situations that we've seen happen in other jurisdictions, whether that's in California or across the nation. And, I know our public health director there, and all the public health directors are always in touch with each other. And I think it's just, we're really in a lot of uncharted territory. I mean, I think as I mentioned before, with, floods and fires, like we know, like if we get this much rain at this time and in this area, we know what resources we have to mobilize. And that has been something where we've been in more of an uncharted territory with the response to COVID-19.
Is it fair to say that global pandemic was not something you practiced a lot with your EOCs? EOC being Emergency Operations Center or Emergency Operation Plans. Is that a fair statement, or have you actually sat down in the last 5 years and done that?
We never did global pandemic, but we did do, and boy, did it come in handy 2.5 weeks ago, we did do curfew.
Okay.
About 6 months ago, we did a tabletop exercise on a curfew.
Okay.
And it actually very much came in handy.
Yeah.
All right.
And we had plans for it, right? When we have all of these, we have planning and response documents for every type of, emergency we can imagine. But I've kind of been new in the emergency response role over the last 3 years. I'm trying to think if we did one, but, we did have some experience looking at, obviously not on this scale, but with H1N1, with MRSA, we've had measles outbreaks in Orange County. So we have had some of those experiences, but again, nothing on this scale.
Yeah. I think that's, and I don't want people to freak out about this, nor do I want to, and I can say this, maybe you don't want to agree or nod your head to it, but to some extent, governments are having to figure this out as we go. We're trying to understand how to make this work. And it's not like there's some grand plan that was out there that was like, this is totally how we're going to get it. And there's been a lot of pointing to data out of South Korea and other places that have, crushed the curve, so to speak, or did a really good job out the gate. And I think some of them benefited from previous exercises they've hadn't gone through with SARS. So they knew coming out the gate what they were going to have to deal with. So they've done forced tabletops on this where we'd never necessarily had to come to our shore to the point that we had to respond. I sense that's one of the challenges for government in general.
Yeah, no, I very much remember conversations with our director of public health, our public health officer, say 2-3 months ago. hey guys, we need to start looking ahead to when we reopen. Do we need to come up with guidelines for how restaurants might reopen or how retail? And the answer 2-3 months ago was, oh, don't worry about that. The CDC will do that for us. Oh, don't worry about that. The state will do it for us. And of course, none of that has happened. And we've had to create all of this on our own.
Yeah. So one of the, I'm going to start filtering in questions that are coming in. I also have a bunch of other questions to get to. Some are kind of like big picture, big liberal arts questions that I would love to tackle with two brainiacs like the ones that we have as guests here. But there is a relevant question that actually comes up that I see here from that John McDowell answered, which is, how are enforcement efforts of COVID restrictions working? So the note here is about NPR, who was covering an LA study that showed like half the restaurants weren't actually adhering to the guidelines. How are the counties, especially Sean with you, since you have county and city, but how are we going about seeing that restaurants are actually adhering, or is it, kind of Scout's honor system?
I mean, for us, perhaps because it's 49 square miles, right? San Francisco's not the largest county. There has been reporting that has gone largely to our city attorney. City attorney enforcement's team has handled it. And police department. We have had fairly good compliance. Just a simple anecdote. This weekend, I was on a neighborhood commercial corridor in San Francisco, taking care of something. 80–90% of the people walking along wearing their masks. Later in the day, I had to go down to San Mateo County, just 20 minutes south. 30–40% maybe. There seems to be a acceptance of some of the mandates here. People have really bought in.
All right. Jessica?
Yeah, the enforcement has been a challenge. And I think at least what we've seen from our law enforcement personnel, as well as our public health folks, environmental health folks, is more of an education-based approach to help them be in compliance. And I guess maybe this is where, I don't know, I'm a pretty good rule follower, so I like to think that people, if they know the rules, that they would tend to follow them. That might be naive on my part, but I do believe that people want to do the right thing at the end of the day. And if that happens to be following the rules, which, so be it. So I think that's been a lot of the work that we've been doing, is more of the educational piece. Orange County is, although we're pretty dense, we're not as dense and, as San Francisco. And so one of the things I know that they did was they went and, a lot of the restaurants, the environmental health inspectors who are regularly in touch with those folks and have good relationships with those restaurant owners, did a whole informational campaign and passed out a bunch of flyers as to here's how you do it. And here's what you need to do. Here's how you post your attestation that you completed all these things and you need it in your window. And I think as we kind of get that information out there, there's also, anecdotally, we heard that, some folks, if they don't see that sign in the window, it's kind of becoming like that restaurant grade. Maybe don't go in if you don't see that up there. Right. So I think you see a little bit of that, but in order for us, there's a lot of restaurants, a lot of retail. It's difficult to make sure that everyone's doing it. And again, it's more that education campaign that has been our tactic, is to make sure people know what they're supposed to be doing so they can, because it's in their best interest, right? A restaurant or a retail location they don't want people getting sick in their location. So I think if people know what they're supposed to do, they're trying their best to do it.
Yeah. Well, I do feel compelled to observe from my friend Sean Elsbernd that the good citizens of San Francisco love themselves some government. So the fact that they want to comply with it is not particularly surprising to me, just to be fair. So Jessica, you probably are not really going to want to comment on this, but we've had a recent transition in our public health officer here in the county. That was, I think, I can interpret something. Well, first of all, do you have any comments you want to make about that, or any observations?
Well, I think, unfortunately, we're not the only county that's experienced that, right? I think I read an article last week that said over 24 and I know maybe that's not a lot nationwide, but seems like a lot to me, of public health officers who have left either because of either on their own accord. You know, our public health officer received some threats, and that was very unfortunate. I'm all for healthy discussion and disagreement, but when you start threatening someone, that's not acceptable.
To be clear, those threats were coming from the public, not from Board of Supervisors?
Correct. Threats from the public, yes. And, you know, putting someone's home address out there and threatening to come to her house and different things like that, I think that's over the top and not the best way to resolve differences, to put it mildly. So, so yes, we did have, you know, Dr. Quick did tender her resignation, which was very unfortunate. She'd done a great job, and we were very lucky to have her for the time that we did. And so now we have our healthcare agency director, who's also an MD. He has assumed the role of acting public health officer while we recruit for that position.
Okay. And I think it would be understandable for most people on the team to understand that it's also an employment, it's a personnel issue. So Jessica probably can't elaborate in great detail on that. I mean, I will tell you, I'm an Orange County resident, so she is my public health officer too. There was immense political pressure around those issues. Orange County does not have the breadth of people who love themselves some government as much as San Francisco. So there's some different attitudes on this stuff and different disagreements about wearing masks and things of that nature. I'll leave it at that.
I'll let that slide for now, Ryder.
Thank you, Ellsberg. Appreciate that. So I guess let me ask one broad, just quick question to you both. What's been the most surprising thing to you about the pandemic? So many things.
There's been a lot of things that have been surprising, unfortunately.
I mean, maybe we can go back to one of the first things that Jessica said, the length. I mean, there was definitely some thought, February, March, okay, everything will be good to go by the end of the month, or we'll be good to go by early May. And now the realization has really sunk in. We're in this through the end of the year, that the whole concept of return to normal isn't going to be with us for a very, very long time, that there is definitely going to be a new normal. Just all of that dawning and getting a better understanding of how we will all live our lives, that this declaration of emergency, that this issue would change that so dramatically. That's the biggest surprise for me.
Yeah, because I'll talk about a funny story. So you can't see on the camera, because luckily it's not like a full body shot at the moment, is I am 36 weeks pregnant. So when I was up at the EOC, I was 24 weeks pregnant, somewhere in there. And I would always joke with everyone, I said, okay, like, can we all just get this like buttoned up by like the first part of the July, because I got a baby to go deliver. And I want to make sure there's a hospital room. And I would, and I would jokingly say that, right? And everyone's like, oh yeah, totally. Like, we'll totally be done by then. And obviously we're not. So I think I would agree that the duration of it has been very challenging. And I think also this is kind of where we get back to being an employer as well. I think the challenge to our county workforce, with our 18,000 employees at any given time now, we probably have, 60, 70% who are working from home. And like many of you have probably experienced as well, it was that challenge of transitioning those folks home and finding, some people's jobs didn't transition super well. So trying to find work for them to do that they could do from home, whether it was training or whatever, and trying to balance that with obviously childcare needs that people had as a result of school closures. And so I think you're dealing with the response on so many different fronts. And that's what's been challenging. It's one thing if you're just dealing with the response to COVID, but you're also dealing with how you support your staff and, the people that you work with and how you manage them remotely and all of those things, which government, I mean, at least at the county, we had very few people who telecommuted. So we didn't really have the infrastructure to do it. We figured it out, but it was a little clunky at first. And so I think that's kind of been another challenge, is the duration and then managing it from a lot of different perspectives.
So I would observe that in all the clients that I work with and whatnot, and I should say that Trepeppi Smith is an entirely remote workforce. So 22 people on our team, 6 or 7 of whom, by the way, are Claremont College's graduates, mostly CMC and one Pitzer and 1 Scripps. We are entirely remote, so everybody just gets a laptop and cell phone, works from home. We're used to that work environment. Most cities don't at all have that. And this has really forced a sea change in their worldview and perspective on labor management. It's all kind of gotten gummed up with contract negotiations and labor union agreements. I'm sure the civil service stuff, which is steeped in San Francisco, and how they handle things are getting very complex. And it's really challenged government. At the same time,
we have labor unions in Orange County too, Ryder.
Yes,
so you don't just have to single Sean out.
I
We do
know.
have them.
Ryder, let's see if you can keep a straight face when I say this. I had to meet with the labor unions who were requesting a Wi-Fi premium onto their paychecks because they now had to telecommute. They wanted us to pay for their home Wi-Fi. I knew you couldn't.
Well,
Doesn't hurt to ask.
Yeah, I can understand why they would ask for it. So at the same time that's all happening, we're just crushing our economics on the public agencies. So now it's also having to change our total model about how we think about delivering services and doing that cost effectively. So we had some general questions that were asked about economic impacts. We talked about some of the numbers like unemployment, but from a revenue generation perspective, could either of you comment on the percentage impact that's at least foreseen? And most agencies, by the way, for the audience, usually their fiscal year starts July 1 and goes through the end of June. So we are at the tail end of our 2019-2020 period. Can you comment on just fiscal impacts you've seen for your agencies, if you happen to know?
Sure. Jess, you want to go first?
I don't have the numbers off the top of my head, but it's not good. And we're waiting to see what happens at the federal level. There's been discussion on, some of the COVID-19 response bills that might look at backfilling some of the funding to local government. And without that funding, you'll see reduction in service. There's just no way around it at the local government level. And so that's especially challenging because, when we actually see in counties, when the economy's bad, there's a greater need for our services, right? So you actually see more people needing social services or public health services or things along those lines. And so that it's kind of the double whammy effect of that. So that's one of the things that, our budget folks had been working on since, probably since early March, is looking at those revenue projections. And obviously the funding from the feds did help in terms of the COVID response, but those dollars also they were restricted to certain uses. And for us, we fund, sales tax is also a, component of our budget, and seeing reductions in some of those in the sales tax is definitely going to impact us too, as well as kind of long-term effects on property tax. That takes a little longer, but definitely going to see some major impacts at the local level.
Sean, you want to comment?
Sure. For us, with the declaration of emergency, you're right, Ryder. Normally this would be the time we'd be doing a budget. But one of the things that the mayor did, as she can do in a declaration of emergency, is pushed out our fiscal year to start October 1. We just did a continuing budget to carry us from July 1 to October 1. But to put the numbers in perspective, San Francisco is approximately, or was approximately, a $12.3 billion budget. Mid-year, so that June to October 1, we had to cut $300 million. And for October 1, we are pegging right now an $850 million deficit. And it is largely because of lost sales tax. Hotel tax is a big one for the city. The other entity they're within our jurisdiction, but they are what we call an enterprise department. They generate their own revenue and spend their own revenue. That I suspect is not unique to San Francisco is our transit agency. Transit revenue has just plummeted. And there's going to be massive service reductions with our what we call our Muni service as a result. There are our supervisors, our legislative branch on Tuesday put forward a number of new revenue tax proposals for the November ballot. Yesterday, I sat down with our labor employees and made a request for a 2-year wage freeze, which would save us a few $100 million. So it's the Budget Balancing Act is going to be extremely difficult over the next, and we only have, the mayor has till, for our process, August 1st to introduce to the board a balanced budget, and then they play with it for about 6 weeks.
Has San Francisco declared a fiscal emergency and adjusted to just a general emergency?
No.
Okay.
Just the declaration of emergency.
Okay.
And we did the same with our budget. We, normally June is when we're all ready for the budget hearings, and as a big government nerd, like I love that process. And it's, they did a similar thing, just approved the base budget in early June, and then we'll look to tackle it again in September.
Okay. I promise everyone I'm trying to get through your questions. There's a lot of good stuff here and we're getting through them. So there was a question from Tassif asking about how you build trust and buy-in from constituents on science, effectiveness of mass, comorbidity risks. Any ways local governments are seeking to do that, or things you found particularly effective in addressing those issues? I certainly have my thoughts given the work we're doing for cities, but please, I'd love to hear your ideas.
It's education and it's transparency, and it's a tremendous amount of outreach. It's particular in San Francisco, for example, let's use Chinatown, right? We have a number of monolingual speakers who do not necessarily trust government. Working with nonprofit agencies in Chinatown, working with nonprofit agencies, say with our undocumented population throughout the city. When the government approaches, they don't necessarily want to listen. So you've got to find, in a sense, ambassadors who can communicate with folks. I know this is a Claremont McKenna event, but I do have to give another plug to UCSF. Their kind of stamp of approval is extremely valuable in the community. We've been very fortunate in that regard.
Jessica?
Yeah, and I think it has been, trying to find different ways to communicate. Obviously, we're leveraging social media, but how else you're getting the word out? And we're facing that right now with regards to getting information out on testing. So that's the big push for us at the moment. Also, I think we've never done more press conferences ever. And, that's another way to, get the word out, but it is just communicating. You can never communicate too much, providing that data and information, and just, trying to educate folks as best you can. And I think it's really given us the opportunity too to focus on the in-language outreach as well for many of our communities.
Do either of you have professional organizations you're turning to kind of get best practices, or network and talk with peers to get some best practices information? Like, there's ICMA out there as an organization, for example. Jessica, you and I have been at some of those conferences in the past. Or Sean, are you talking to chiefs of staff from Chicago and New York, or other cities around that have some insights?
It's funny you mentioned Chief of Staff of Chicago. Mayor Breed and Mayor Lightfoot are buddies. And through that relationship, I have become friends with Maurice, Mayor Lightfoot's Chief of Staff. And yes, actually, we have exchanged a few things, especially when they did their first health order. If you take a look at their first shelter-in-place order, it is almost verbatim the San Francisco health order. Mm-hmm. So yeah, we do have some conversations. across the country, but our best sources of advice and how to communicate are really our on-the-ground nonprofit agencies, our on-the-ground ambassadors who know the community so well. That's who we've been relying on.
Okay.
And for us, I mean, I know a member of our Board of Supervisors is now the president of the California State Association of Counties. So that has been a helpful group for us. And then, you know, it's one of those things where you're thankful for those relationships you build before you need them, right? So our CEO meets regularly with all of the Southern California CEOs. And so now I think they probably meet weekly to discuss what's going on. And similarly, and it was just kind of, you know, my public information officer was something she wanted to do was building relationships with all of the public information officers at the city level. And, you know, that was in the last year. Well, we're really fortunate that we had those relationships because, you know, a lot of that information outreach, you know, people often connect more so with their city than they do with the county. So being able to get that information out to those city PIO, public information officers, and help them spread the word.
Yeah. So we have an elected official on this call, Supervisor Lopez. And Supervisor, if you tell us which county you're from, that'd be awesome. Unless, Evan, you happen to know off the top of your head, class of 08. So the question is, do either of the speakers feel concerned about the lack of local control on the phasing, especially before attestation? And if there are any advising, if they were advising state level government in an after action, what would their recommendations be?
It's much easier for an elected official to answer than a lowly staffer. I can tell you that.
It has not really been a problem for San Francisco because truth is we moved quicker than they did. I mean, we put our shelter in place order in place 5 days before Newsom did it for the state. We have been working a little quicker than they have. We have not, if there has been a problem, it has been, frankly, some of their guidelines are not as detailed as we would like. There is conflict in some of their proposals that creates confusion. And that has been the one hang up. That said, they have been very, very helpful to us with one area in particular, and that's the vast number of nursing homes we have in San Francisco. State assistance from the California Department of Public Health with those facilities has been very, very helpful.
Okay. There was another question about kind of, and we hinted at this a little bit about changing up the structure of government and responding to COVID-19 and how that might just impact a revolution in delivery of services. So, and I know that this speaks right into labor issues, so maybe not much you can talk about on this front, either of you, but what any approaches in SF or OC that you guys have had in reducing costs without simply just slashing and burning or cutting positions entirely? I'm assuming this is partly labor negotiations or partly looking at outsourcing wholesale services. Any thinking about any maybe long-term cost structural adjustments or other discussions? I mean, sometimes in a crisis, decisions get made that normally seemed impossible, right? 6 months ago. Any insights or observations on that?
Well, I'd probably point to maybe the positive side of that, Ryder, is the collaboration. So one of the things I think, particularly in this response, it was different than most of our other responses is how many departments were impacted and had a piece of that. So, you know, the county, 18,000 employees, 20 some odd departments, you can get pretty siloed in an organization like that. And I think that one of the things, anytime you go through something difficult or a crisis or an emergency, it brings people together and allows them to help, you know, to bring in different points of view and to work together on solutions that probably doesn't happen, unfortunately, on a day-to-day basis because we all get so busy in our day-to-day work. So I think that's one of the things I hope kind of on the long term is that we've built a lot of those relationships across the county. And, you know, it's one of the great things about the emergency operations centers, right? When you have all those people in the same room, you are able to, pick people's brains, work on set aside a group to go like, okay, we need you to go help try to address this. What do you think? And then come back to the policy team and get some additional guidance. So that's one of the things I think is a benefit, is just those relationships, and also you kind of find out maybe some of those rising stars you didn't know about, who really stepped up during the emergency and, hopefully can continue to do bigger and better things for the county.
Okay, Sean?
No, Jessica, I think Jessica answered that question perfectly. That's we've shared a lot of that experience.
All right. Any lessons learned about communication strategies? What worked? What would you do differently having communicated? Again, I could probably talk at hours for this, but you're the guest, so let's hear from you guys. I heard nonprofits from you, Sean.
Yeah, I think that one thing I would have liked to have done a little bit more of is gotten the mayor more in. She did Monday, Wednesday, Friday, either 11 o'clock or 1 o'clock press conferences. We had to do 11 or 1 because Newsom did noon.
Right.
So we had to make sure we weren't going up against him. And we had, all of them were at this studio we had built down at the convention center, at the Emergency Operations Center. I think it would have been better for her to get out more. Sure, we had a shelter in place, but there were things that were going on that she could have featured a lot more. There were people, volunteers, city employees. I think one of the highlights for me, our libraries have been shut down, right? Well, we have hundreds and hundreds of librarians. That's not a job you can telecommute, but we have, in a sense, they have all been repurposed to be disaster service workers. Hundreds of librarians who are now delivering food from the food bank to people who can't get out of their homes. Highlighting some more of the successes beyond just the flattening of the curve. We should have done some more of that.
Interesting. All right, Jessica?
And I think it is one of the things that it reminds you, right? I mean, obviously Sean and I have both, had long careers in local government, but I think telling those stories is really important. And I think that helps build the trust with the public as well, is that letting folks know that you have a lot of really good, smart people who are working really, really hard to address this. And I think sometimes that gets lost because we think of ourselves as public servants and this is what we signed up for. So we're not always very good at tooting our own horn and talking about that. But I mean, especially in our public health, I mean, those folks have been running, 80, 90-hour weeks for 4 months. And, I don't know how they're doing it. I really don't. But they are, and they're not complaining, and this is what they signed up for. So trying to, I think, highlight, because I think it also puts a face to the response. And, our healthcare agency has started to do that recently. We've been doing some fun profiles of, folks who are just on the front lines, answering phone calls, providing service out there in the field and doing that day in, day out. Because I think it also helps kind of demystify county government, which is always something that we can never do too much of.
Right. So Evan, I want to be sensitive. It's just now 6 o'clock. I'm okay continuing on for a bit if Sean and Jessica are, but I want to be respectful. Obviously you both have things going on. And I also, Evan, I don't want to blow up your schedule. So can we take another 10 or 15 minutes of questions, or 10 minutes at least?
I'm certainly fine with that. I appreciate all of your time. If Sean and Jessica, if you're willing to do another 10 minutes, I want to, thank everyone on this call who's joined us as well. If you do need to sign off, go ahead and do so. But let's do 10 more.
Okay, there's a bunch of questions here and I want to try to be responsive to folks. So there's just a general question about federal legislation, point made that some of the initial bills that have passed, and just for everybody to know this, they all really funded big organizations. So I think Orange County, San Francisco got money out of the initial federal legislation that came out, whereas all the smaller cities got bupkis, except for maybe some trickle down that came via the courtesy of counties to share some of that money for the most part from what I've seen. You guys can tell me if I'm wrong in that perception. So I guess having said that, are you actively supporting additional legislation, and how much more money can we print for you guys?
We are supporting additional legislation. There's a lot of things that were not funded in the first, we aren't able to backfill some of those shortfalls that we've seen in revenue loss at the county or the city level. And that's going to be critical to service providing going forward. So we did receive, and we're very thankful for, a large amount of money. It was one of those things when that got wired, we're like, wow, okay, I'm not sure when we've seen that much money wired to our account, but that we're very appreciative for, but we are continuing to request additional funds to help support local government response.
Okay.
As are we, Ryder. And if you'd like to turn this into a conversation about the failures of the federal government here and how local government has had to step up, I'm more than happy to go there, Ryder.
That might take more than 10 minutes, Sean.
Federalism, Sean. We just gave you the state's rights to figure out how to figure this out.
Okay. Thank you, Ryder. But yes, San Francisco did receive funding. Some reason the number $196 million sticks in my head. I think that's about right. All for COVID response, and I do see in the comments there's an individual from LAX here. Our airport did receive a good chunk of that money, but all the money has been spent. I think it's called the HEROES Act, Jessica, the bill that's pending in Congress, and yeah, we would love to see that measure passed.
All right. Sean, by the way, there is a California Mayor's Coalition out there that's actively lobbying to support the smaller cities. If Mayor Breed wanted to throw her support behind the California Mayor's Coalition, I'm sure the small city mayors would really appreciate that help.
Thank you, Ryder. Thank you.
Yeah, just want to give you that opportunity, just in case you want. Let's see, next question. By the way, there's a lot of debate in this chat between some labor attorneys about this request for funding of Wi-Fi, Ellsberg.
I've noticed.
Epic CMC moment. That's pretty fantastic. Okay. Let's see here. Oh my God, this is all debate about compensation. Actually, great question that was asked. So how are you going to, as local agencies, Sheriff's Department in both your case, old Police Department technically in San Francisco.
We have both. We have both.
You have sheriffs and police?
Really?
Yes. The sheriffs are responsible for protecting the county facilities, City Hall, General Hospital, the courts. So yeah, no, we absolutely have the jails.
Okay. Look at that. Learning something new every day.
No.
Amazing. ABL, always be learning. All right. So I'm walking down the streets of San Francisco and I don't have a mask on, and this new state order says I'm supposed to have one. Are you guys going to throw me up against a wall and slap some duct tape on my face? How are you guys going to handle that?
I think the first element actually in San Francisco is a little social reckoning. I think there's going to be, if I saw you walking down, I'm not a sworn officer, I might say something to you, Ryder. I think there's going to be a little of that. But no, the police, the way they've been handling it, because we've had a mask order for a number of weeks. And there have been a number of requirements about social distancing. And the way the police have been handling it has been, I think to use Jessica's phrase from earlier, education, warning. They're not necessarily arresting people, citing people. And we've had, again, as I've said, pretty good compliance.
Okay. Jessica?
I think we will be continuing our education focus and trying to, and the other tough part that comes out of it, right, is that you do have some individuals that aren't able to wear masks for health reasons or other reasons. And so that's also, we also want to make sure that there's not any of that like public shaming of those individuals going on as well. So that's, I think one of the things that our public health officer has mentioned too is that we, expect people to comply, and that hopefully folks will also kind of give a little bit of benefit of the doubt of someone who may not be wearing. For example, I have a 2-year-old, well, she's not 2 yet, but I have an almost 2-year-old who is the size of a 3-year-old. So people would think she probably needs to wear a mask. She's not, she's just a big kid. And so, it's one of those things where, that's an easy one, right? But, making sure that I think there'll probably be a little bit of, you know, kind of encouragement from friends and family and things like that from time to time, but that education piece, I think, is been our method.
Okay. Looking at the time here, I'm going to indulge with just a couple questions because we're probably not going to get to every single one of these here. But I want to indulge in a couple from my perspective. So you're both alumni of the Rose Institute of State and Local Government. God bless it. So am I. Love that place. What do the Rose mean to you as a CMC student, and how has it affected you deep into your career?
Go ahead.
John,
Jessica.
you first.
I hired you, Jessica. You have to go first.
Okay, boss. So, I mean, it was a critical, and actually you hired me late. I wasn't hired right away.
Oh, Sean.
You know, but
You waitlisted Jessica?
I did, but that didn't hold me back from, you are the first person I ever made a political contribution to when you ran for supervisor. So there you go.
Thank you, Jessica. Thank you.
So it was not only making great friends, learning great research and analytical skills, but also I think being able to learn leadership skills on the job at a very young age has been very helpful. And we had wonderful role models who, you know, taught us to lead by example. I think I always kind of recount that even though he, you know, sometimes, you know, there was no job too big or too small for Alan Heslop. He'd be at the copier making copies. I could make him copies. I was like 18 years old. He didn't need to be making copies, but you know, he really taught me from an early age to never ask anyone to do something that you wouldn't do yourself. And I'm forever thankful for that.
It's a good lesson.
I mean, I think for me, the Rose Institute, the Rose Institute is why I see Coach Sutton here. The Rose Institute and John Goldhammer are the two reasons I went to Claremont. I remember very well my tour as a senior in high school. It was a regular tour, and then all of a sudden they took us into this place called the Rose Institute. And seeing the students doing this work that was well beyond anything you do in a classroom. They had clients. They were performing it, or they were putting together a product, and opened my eyes to redistricting and opened my eyes to local government. And you know, again, I see Professor Pitney here. He can tell you, I wrote my college thesis based on maps that I did at the Rose Institute on districts here in San Francisco. I mean, the Rose Institute is the foundation of so much of the work that I've done throughout my career.
That's awesome to hear. And then to close it out, we've talked a lot about government and your guys' efforts to respond and being on the front line. So would you just offer some thoughts on why local government is sexy, why CMC students should find it to be a great career, great profession to get into, things you've learned and experienced being in local government?
I mean, for me, having also had 6 years at the federal government level, working with Senator Feinstein, local government is where you can really change people's lives. Local government is really where you can impact people. Local government is where the action is at. Local government is where you can, God, I worked for Senator Feinstein for 6 years. How long did we take to pass one bill? And that bill got so damn watered down, I'm not sure it really impacted anything. And she's a senior senator. This is where we can really impact people and make change.
Yeah, I totally agree. And it's one of those things too, where I feel as though government needs good people. This has been an especially gnarly thing that we've been dealing with, and but local government deals with a lot of other very complex problems that there aren't easy solutions to, and we need good people willing to, you know, dedicate their lives to doing that. And you know, I work with a lot of people who could be making a lot more money doing something else, and I'm always very humbled that they choose to get up and do this every day. And I think for me, you know, my dad worked in local government for 42 years. So we kind of joke that local government is the family business. All my sisters were all in the public sector, teaching, community college level, things like that. And I just feel lucky that I get the opportunity to wake up every day and try to, as Pollyanna as it sounds, try to make the world a little bit better every day. And it's an honor to have the opportunity to do so.
Well, that's awesome. I want to thank you guys both for doing this panel and for your work. Jessica, for me, since I'm one of your residents that you're trying to take care of, so thank you for that. And Sean, thanks for trying to keep San Francisco on the up and up for me so I can come visit you and enjoy the sights and sounds of San Francisco and fall in love with government all over again every time I come visit you up there. And I would just say, I want to echo both your comments too about the importance of local government. It's certainly one of the layers. It's an important layer. We live and breathe it every day. That's really the government we interact with the most, even though all of our attention seems to be focused on the state and the feds especially. And I would just generally make the point, I like to remind my clients of this. There's probably no time in recent history that so many people in America have had so much contact with government. Curfews being a prime example of that, right? Being under shelter in place orders being a key example of that. It's put a lot of attention onto local government, which has raised fundamental questions about the role of government in our lives, fundamental questions about our relationship with government and how it works, and are we involved in how we're involved in that process. And it's a fascinating time to have a liberal arts education from CMC to think about it from multiple perspectives and try to assess what's going on. So I'm thankful to CMC for that opportunity, and to my many fellow alumni who have helped keep my horizons expanded and give me lots of good insights and information to think about as we go about doing what we do here in the local government world. So thank you again to Sean and Jessica for your time today. Evan, I'll throw it back to you, and thank you for the opportunity to be a moderator today.
Ryder, thank you so much. You were a fantastic moderator. I want everyone to know that the Rose Institute is going strong. And of course, Professor Pitney is here as well, who's been so influential in so many of the lives of our government majors. roseinstitute.org to learn more about the Rose. Otherwise, the college's thanks to all three of you. Thank you for being here, for your service to Meade, your friendship, and your mentorship. And everyone be well. I hope to see you next week, where we have Professor John Shields talking about Trump's Democrats, Jenny Taw talking about race and international relations. Next week's programming should be very strong, and Paul Hurley from the philosophy department will join us as well, talking about pandemic liberty. So see you all next week.
Thank you. Thank you all.
I'll unmute everyone. You can say hello, say
Take care.
goodbye. I'm muting everyone now. Bye, everyone. Feel free to.
Thank you.
Yeah, thanks very much.
Everyone.
Thank you, guys. Great
Thanks.
to
Bye.
Thank you.